Hello dear patients, today we are going to talk about the case of urethral reddening and deposits on glans penis. A young man came to us with these complaints after having oral sexual contact. About 2 months ago he had oral sex. It was unprotected, but vaginal sex was protected. As a result of that he had this reddening of urethra. It did not disappear completely. He went to dermatovenerologic dispensary at the place of living. He had analyses done and ureaplasma and chlamydia were found. As a result of that he had doxycicline medication prescribed. Those who prefer magic pills can easily find this medication on the internet. For some time it subsided, then it returned. He didn't want to have tablets anymore and he came for a full-scale treatment. Apart from that, after doxycicline the deposits developed. You can see them on the picture. In this case it's important to take analysis from glans penis and from the surface, not only for sexually transmitted infections, which are mandatory, but also culture test from glans penis. Complete analysis for fungi, this is what we did. Culture test from urethra is also necessary because after intervention of antibiotics, cases of dysbacteriosis are common, particularly the ones that are related to bacteria coli, enterococci, etc. During a routine that is common treatment, it is recommended to do culture test for bacteria in order to combine the treatment with treatment of bacteria in urethra if they are present and to prevent bacterial urethritis. The reason is that the bacteria can be a trigger which still induces the process of bacterial urethritis, bacterial prostatitis, even if infection is gone. In this case we found Bacterium coli in the patient. Secondly, we found Candida albicans. Chlamydia and ureaplasma still remained in this patient. This is common for doctors who treat with tablets only, as the resistance increases, and as I said, no culture test for bacteria was done. In such cases, a complex treatment is necessary. After that, culture tests for ureaplasma were done. By the way, it is not sensitive to doxycicline, so laboratory studies are necessary before any normal treatment. Complex treatment with instillations, antibiotics, enzymes, etc. was done. Generally speaking, this is what is required. I can also say that Bacterium coli was also not sensitive to Unidox solid tab or doxycicline in our case. So in these cases, in cases of difficult infections, when you have 2 or more of them, you can only add candidosis to the list of your problems, as in case of this patient, and not to solve the problem. Moreover, such long-term chronization, inflammation in urethra often leads to prostatitis even in young men. So I would advise to treat 2 or more infections using a complex approach initially, which allows excluding such complications, and to always do culture tests for bacteria immediately prior to the treatment. If you want to get more details about treatment of chlamydia and ureaplasma, you can watch a separate video on our channel. We are not going to talk about it now. However, this usually isn't taking some antibiotics for 10 days, which often leads to situations that we've talked about before. If it's necessary to diagnose and treat any sexually transmitted infections, you can consult venerologists and urologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such infections.